Hello everyone, myself Dr. Zafar Akhtar and you are watching D for Dentistry. So in this video, we will be talking about various types of mandibular extraction forceps and how to identify them. So let's begin. First, we should know the parts of the forceps, beaks, hinges and handles. In mandibular forceps, the beaks are perpendicular to the handle. Let's identify the various forceps. First, mandibular anterior forceps. The blades are perpendicular on the long axis of the handle and there is no space between the blades. Now, premolar forceps. There is a space between the blades. The blades ends are rounded and has no projection. Now, molar forceps. There is also a space between the blades, but both the blades ends have a projection. There is no left or right like in maxillary forceps. Now, third molar forceps. The beak of the instrument is aligned differently. This allows us access to difficult areas such as third molar. Now, cow horn. The beak resembles cow's horn. The cow horn beak provides a sturdy and controlled grasp on mandibular teeth during extraction. And also there is no left or right. Now, root forceps. Their long, slender design provides for ample visibility while the delicate beak secure grasp the root tip. Thank you for watching. Comment if you have any doubt. Subscribe to D for Dentistry for such videos.